I'm ready.
So your doctor ordered an exam today where we're gonna be looking at your small bowel. How we do that is we'll take one picture before we start just to kind of see what everything looks like, and we'll check that, and then I'll go through the rest when we get there. But what kind of problems are you having that he ordered this exam?
I have heartburn.
Okay, heartburn.
Is that something the small bowel would have? No.
No, probably not, but,
She looked lost. What should I
Want
say?
me to change it?
Lots of gas.
have you had a lot of diarrhea associated with that? Do you feel
Yes.
like when you eat, things come in and go right out?
Yeah.
Okay, good. Not good, but that's better.
Could it work if you were like constipated?
Sure. Yeah, because there's some people that eat, remember I said they still feel full, like they eat breakfast and at dinner time they're like, oh, I feel full all the time. Most of those patients will complain of fullness, like a distended abdomen, just not really like they're hungry, and then they get really bloated and just miserable. The other people that eat and it goes right through them, they're like every hour, every couple hours, like you can't satisfy them kind of thing. That's you. That's you.
Yes.
That's
All
Lily.
right.
Those are her symptoms. I sit next to her.
Hold my sandwich. Hold my sandwich. Okay, send me the video.
Give me my sandwich.
So, have you had any surgery to your abdomen?
No.
And these issues with like food going right through you and not feeling full and the heartburn, how long has that been going on for?
A couple months.
Okay.
Liar.
Good to hear. I'm glad it's not years. Let's see. Any pain associated with that, or just never feel full? Really, just always hungry. Have you had any weight gain with that, or weight loss?
Probably, yeah.
All right,
We'll
I'm
just
gonna
say
quit
yes.
torturing you. I'm gonna let you lie back on your back.
Okay.
I would ask that though. I would ask weight gain, weight loss, just because you need to know. And a lot of times they'll ask you at the physician's office. They'll say, "Have you had unexpected weight gain or weight loss, or unintentional weight gain or weight loss?" Because if you're trying to lose weight, then that's good. But like if you're not, you know what I mean? Like if you lose weight and that's not your goal, then they need to be aware of that too. Because there are some people that do just drop weight. Like they eat, they do everything, but they still drop weight.
You're so creepy.
All right.
Like you can never be Santa Claus.
Never.
I don't know. He's got the cheeks for it, but yeah.
Piece of candy go for a ride in my So I can't shield her on this one, but we've got probably a T-shot on her. I would annotate Scout on there. What I'm gonna have you do is take in a breath, and then you're gonna blow it all out and hold it out. Okay? Okay. All right. I'll be right back. You hold still just like that. It's set at 80 kbp at 10 mass. Take in a breath for me. Blow it all out. Hold it out. Good. Breathe and relax.
And this was 2 inches above your ear.
This is a Scout.
Oh, the Scout.
Yep.
Okay.
So no, this is with her at iliac.
Or lower because of
Right.
that.
Never took my marker down. Alright, I'm just gonna put this on the top of the white field. Alright, just like that. Same thing, take in a deep breath for me. Oh, let me show you. Blow that all out. Practice for me. Go ahead, take in another deep breath.
Oh, we're going with shim right now.
Blow that all out. Hold it out. I wanna just throw like something right there. You can relax. At that point, I would probably set that control panel for fluoro, in anticipation of this coming out appropriate. But I would go check this with radiologist, lead tech, whoever I had to clear it with, and make sure it came out. At that point, sorry.
No, you're fine.
I would clear that, And then I would come back in the room. I would move this out of the way. I'll just do it so you guys know. I would move this.
She's like,
And I
I'm
would-
just gonna sit here.
She doesn't have to, but I would let her sit up and I would tell her, okay, now what we're gonna do is I'm gonna have you drink 2 cups of barium. It's this substance is kind of chalky, almost like a milk consistency. If we flavor it, I would. If we don't, I would just tell her that. But what we need to do is try and get all of this down in the next few minutes. And then once you drink that, I'm going to mark the time when you finish. And then we're going to take some time-delayed pictures of your intestine to show how it moves through, okay? Once we're done with those pictures, it could take anywhere from, minimally, we're going to take pictures up to an hour. And then after that, it kind of depends on where it is. Once we're done with all those pictures, though, I am going to have the radiologist come in and we're going to take an image with this camera right here. We're going to bring it across you and take one more image to end the exam, okay? In between, I can let you get up. You can go back in the dressing room. You can read your book, whatever you want to do. But every 15 minutes or so, we're going to come get you for another picture, okay? So she would drink the barium. When she gets done, I would mark time, which 12:35. So at 12:50, I would take my first image, which would be my 15-minute film. Does that make sense? So let's say it's 12:50. I come back in. I have her lay down. I would have her lay on her back. And then I'm going to do the first one, which is a high image to include
Diaphragm and stomach.
diaphragm. Yep. All right. Okay, so crest. 2 inches above. Oh yeah, crest. Okay. And in order to include diaphragm, remember we said it's typically about the level of the axilla.
Mhm.
So that should be more than fine to capture. Even though the light looks like it ends here, I should be able to capture that. So we'll let you keep your arm down. I will put the shield, I'll just put it below light field because it's not gonna be that low at this point anyway. So I've got iliac crest, 2 inches above iliac crest and midline. Left marker. I'm gonna have you do the same breathing that we were doing before, where you take it in, blow it all out, and hold it out, okay?
Okay.
All right, so I'd come back here. This would be set, oh, I didn't tell you that. Somebody take a guess, what do you think this would be at?
110 at 2.
Yep. And it really wouldn't matter if I did 1.7 or 2.5. I'm just gonna leave it on large focal stop though and do 1.10 or 2.5. So take in a breath. Blow it all out. Hold it out. Don't breathe.
No one escapes the camera.
Good. Breathe and relax. I would go check that at 1:05. That would be my 30-minute film. Does that make sense?
Right.
Okay, so at 1:05, I would come back in and I would have her go ahead and roll over onto your stomach for me. Whether she got up or stayed laying down, either way, whatever. I mean, is that uncomfortable?
No, this is fine.
Put this under you?
Oh, yeah, no, I don't even feel that.
You can get Brandon in here and help iron it out for her.
No shame.
Breathe on her too. Breathe on her.
Don't forget to sigh.
Why did I do that last time?
Okay, sorry. I know how ticklish you are. I shouldn't have done that to you. All right. So now I'm actually at crest and midline. Okay. All right. At crest, midline. Now left moves, right? Because she's PA. So this is her left. Oh. Oh. If you ever forget, just do it to yourself. You don't know how many times I go and position myself like them and go, okay, this is my left. I still do it. I mean, rather do that than mark it wrong.
Oh, good, so me and you did the same thing then.
So you like it?
All right, so that one would have been annotated 15 minutes. This one I would annotate 30 minutes. Okay, so same breathing. Take in a breath, same technique. Blow it all out. Hold it out. Don't breathe. So that would be 105. So at 120, I would do my 45. So I would have her go ahead and roll back onto your back.
I thought in the book it said that after like the barium moves through, like after the first image, you can reduce your KVP because it's more spread out, or do we just leave it the same?
And
Maybe I read it.
might say that, but I've never reduced
You've never
it.
done it.
Mm-mm.
Just leave it the same.
I mean,
That's why.
it spreads out, but there's still a ton, like all your small intestines. So I've never seen them lower it. Maybe they do now with digital. I don't know.
Maybe.
You'll have to tell me. I'll have to look into
But
it.
as for the sake of like our comp and everything, we would just leave it the same.
I would leave it the same.
Okay.
Alright, so patients never roll, like, remember it was at crest?
Mm-hmm.
Patients never roll in a perfect circle. I mean, you can't. I'm not ragging on her. I'm just
So
saying.
just make sure.
Don't ever, right, don't
just
ever
keep finding your
assume.
landmarks every single time.
Yep. Alright, so still crest and midline. This is 45 minute. Take in a breath for me. Sorry.
Very good.
Blow it all out. Hold it out. Don't breathe. Deep. Good. And then 60 minute, which would be 135. I would have her roll over. Can you go with me on that?
Yeah, same thing.
Okay. So she would go PA. It would be at crest, midline, left marker over here. When those were all done, I would take all those images to whoever I checked the scout with, and I would check and see where everything was. Now, granted, I'm going to know by looking at the 60-minute film where the barium is. If I'm seeing barium all over here, which would be on the cecum and ascending side of the large intestine, if everything is over here already and already going up, then I'm probably knowing that I'm going to set up for fluoro. If the barium's still all the way over here, nothing's really moving over, I'm probably going to have to wait however many minutes or however long they say. So whatever they say, I would go according to that. Now, like I said, I have had doctors that will tell the patient after an hour to go down to the cafeteria, get a cup of coffee. A lot of people have coffee in the morning. I mean, not being gross, a lot of older people have coffee and then they have their bowel movement. So it does get things going. So that would be, I've had them send them to breakfast. I've had them go down and have coffee. I've had them tell them to go walk around the hospital and come back just so they get some movement. But if they told her to come back, then we would just mark the time. And then say they told her to come back an hour later, then that would be my 2-hour film. So I would mark it accordingly. If it was already there, then I would move the overhead tube out of the way, pull the fluoro tower across, set everything up for fluoro, pull the foot pedal out, move the Bucky down to bring out the Bucky slot shield, and then myself or whoever was going to fluoro would come in, lower, either use the compression paddle, typically over here to kind of push on the stomach to flatten it to see that ileocecal valve, or on the underside of the fluoro tower, there's like a little cone that comes out that they can bring that down and push on the patient. But we would spot that ileocecal valve. That would deem the exam complete when we are able to spot the ileocecal valve. Once I do that, I'm going to move all of this, and I'm going to let her get up. Thanks. All right, we'll let you sit up. Just watch your head. Now, what I'm going to do is bring you back and let you get dressed, but I'm going to tell you that you drank a lot of barium today, and that has a tendency to stay in the system. We have to flush it out with water. So you can go back to drinking whatever you drank before, coffee, tea, juice, anything. You just want to add like 8 to 10 glasses of water on top of that to flush it out. And your stool will be white for the next few days. That's normal. That's the barium coming out, so don't let that alarm you. Once your stool goes back to a normal color, you don't have to keep up that water intake. It wouldn't hurt, but you don't have to keep it up. Okay? All right, and then your doctor will get those results, so we'll walk you back and let you change, and then I'll watch you. Okay? All right. Not hard, just flip-flop KUBs. That's all it is. The first one's high. so that you capture diaphragm and the stomach to see if anything is going on up there. And after that, it's pretty much at
And we stay
rest.
open at the 14 by 17?
Question. If you have to have them come in for something after the 60 minutes,
Yes.
do you continue to flip-flop them, or do you do it wherever you want to?
You probably after the 60 would probably, you're at that point you're just looking for ileocecal valve. I would probably just lay them on their back. Most of your patients are going to be more comfortable on their back than their stomach, but if you felt like the first few images there wasn't a lot for them to see, like it was still way over on the left, I might flip them over, but there's no protocol that says you have to,
Okay.
and you can stop.